welcome to Medical Dialogues. I'm Roshni Dhar. Let's look at today's top news. Ganga Hospital cleared by Medical Council. So Ganga Hospital, Delhi has publicly addressed a ruling from the State Consumer Disputes Redressal Commission mandating compensation for alleged negligence in a splenectomy case. The hospital was surprised by this order, especially after being cleared of any negligence by the Delhi Medical Council, the Medical Council of India and the High Court of Delhi in the previous evaluations. The statement came in response to a judgment that ordered the hospital and its doctors to pay for damages, mental anguish and litigation costs due to supposed medical negligence which resulted in a misdiagnosis and improper post-operative care. The hospital's press release emphasizes their disagreement with the Consumer Court's decision, highlighting the Medical Council's and Court's prior findings which absolved them of negligence. The hospital stresses that the medical reports used in their defense was misunderstood by the State Commission, leading to a controversial ruling. It points out a specific error in an ultrasound report that mistakenly identified a normal spleen size despite the organ's prior removal, an error attributed to the ultrasonologist oversight rather than the hospital or its doctors. MP doctors outburst towards guard in Chhatarpur court on video.
अरे तुम निवेदन नहीं करते हो, तुम लोग डंडा करते हो, हमें मालूम है कितना तुम निवेदन करते हो, तुम्हारा निवेदन करने का तरीका मैंने देखा। चलो अभी कलेक्टर साहब के पास चलते हैं। ये तुम लोग 2-2 हज़ार रुपए लेके बिकते हो ना, तो हमसे फालतू बातों की मत किया। हाँ, हमने उसको खरीद लिया। तुम बिके हो आदमी, खरीदा नहीं तुम। बिल्कुल बिके। नहीं कर।
In Chhatarpur, Madhya Pradesh, a heated altercation between a doctor and a home guard who was assisting an accident victim escalated quickly and was captured on video, sparking widespread outrage on social media. The incident occurred when the home guard, in his duty to ensure proper care for the injured, requested a CT scan and X-ray for the patient from Dr. Arunendra Shukla. The situation took a turn for the worse when the doctor reacted negatively after the home guard mentioned the district collector's name, leading Dr. Shukla to angrily toss aside the documents and refuse to continue his work.
एक कलेक्टर वेक्टर की धमकी दोगे, नचवा दूंगा चाचा तुमको। कलेक्टर वेक्टर से डरता नहीं हूँ। पहली बात तो सुनो, अस्पताल में गुटखा खा के आना नहीं।
The video vividly documents Dr. Shukla's confrontational response, showing him clearly stating his disregard for the orders from any collector or official, contrary to the expectations from a medical professional whose duty is to provide care and assistance. Pharmacist gets life sentence for triple murder in 2014. In a significant legal decision nearly a decade after a tragic incident, Sneha Swire Samal, a 50-year-old pharmacist, has been sentenced to life imprisonment for the murder of 3 individuals. This verdict was delivered by Justice Devasis Raut of the First Additional Sessions Court in Bhubaneswar. The victims of this crime were orthopedic surgeon Atulya Chandra Meher, his caretaker Prasant Bahera and his son Meenu. The attack, which occurred on October 14, 2014 at Dr. Meher's residence in Khandagiri, also left Prashant's wife Renu and their other 6-year-old son severely injured. The motive behind this brutal act was reported as revenge. Samal harbored resentment towards Dr. Meher for recommending expensive tests for his daughter's leg pain. On the day of the murders, Samal, armed with a knife, launched an attack on the caretaker and his family, who lived on the ground floor of Dr. Meher's house, to eliminate any potential interference. Upon hearing the disturbances, Dr. Meher came downstairs only to be fatally attacked by Samal. New Utah research suggests that menopause might be postponed forever. Girls are born with a million small structures called primordial follicles. Each of these contain an egg cell. As girls grow and develop, most of these follicles die, and each month just one follicle typically ovulates a mature egg. Pioneering research from the University of Utah has opened a new frontier in women's health, suggesting the possibility of indefinitely delaying menopause through an innovative technique of ovarian tissue cryopreservation and transplantation. This method, which involves the removal, preservation and reimplantation of ovarian tissue, promises to push the boundaries of fertility beyond traditional age limits and improve women's health outcomes significantly. However, this study proposes a transformative approach that could alter this natural course, potentially enabling women to bypass menopause altogether. Originally conceived to assist cancer patients in preserving fertility ahead of treatments that could lead to infertility, this technique uniquely influences the timing of menopause, unlike egg freezing or in vitro fertilization. The collaborative effort, spearheaded by Sean Loyley alongside Joshua Johnson, Jay Merson and Kutluk Okte, a Trailblazer Infertility Preservation utilizes mathematical modeling to investigate the feasibility of postponing menopause. The findings, published in the American Journal of Obstetrics and Gynecology, indicate that preserving ovarian tissue before turning 30 could markedly prolong a woman's reproductive years, possibly eliminating menopause for some. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.